But now summer started, by the way, the people will get more predominantly temperature arises. But now as per the theoretical aspect, and also practical aspect, we would like to know that what are the acupuncture points or the acupressure points to be activated. First, you remember the heat get excessiveness. Where do you get heat excessiveness? Which part of the organ will get excessiveness, or what are the meridians are incorporated in this? So as per the theoretical aspect, as per our system, normally you remember two organs. One organ to be known as a small intestine, that is the tenointestinal orb. Orb means organ. Right. The second organ is triple wormal, also to be considered as a spinal cord meridian, or maybe something connected to the thermodynamic meridian or the endocrine meridian. So these are the prime meridians to be known as these are the two meridians when heat get flares up in the colon that causes the temperature normally. So that situation, what need to be done in the preliminary stage, maybe see if the temperature is there around 99 degree, may not be required any kind of the treatment, except required only the hydration. No acupuncture is required for them. No medication or paracetamol or acetaminophen antibiotics are required on that situation. If it is less than 100 degrees their temperature, that time the whole world, people today, temperature comes and immediately they rush and they take the pills. That's really not advisable. The temperature it comes to you, that is your friend, is not your evil, not your enemy, by the way. But yearly once is getting the mild temperature, that always is good. If it goes greater than 103, 4, 5, but really that is hazards to the body system, but medical intervention is obviously required. Number 2, when we get the temperature on that time, you just hydrate by using the water, tender coconut or something like that. You just use it and don't use any acupuncture point as well, may not be required. Number 1. Number 2, still we have the phobia, maybe tomorrow need to go to the school or college or somewhere else for the job. On that situation, you wanted to use some of the points, you just sedate to the excessive fire indicating in the small intestine, you just shauza is a SI1, you just sedate to the SI1, sedate to the SI1 point, and then you just, not rather than sedating, you just bleed. That's advisable. Bleed the point called as a SI1 and also Quanchum, that is Sanjo 1. Both the points you just bleed it. That itself having the positive impact. By the way, there is a Ching well point and Ing spring points. That's called as a Ing spring points called as a Chiango and then Yamen. That is SI2 and then Sanjo 2. These are the 2 points is always is good, even to treat for the pyrexia as well. What are the points? You just add up the SI2 and then Sanjo 2. Both the points is always is good to treat for the temperature. You just activate these points are cold point as well. This is the metal and this is the water. These points called as a water points. What is required during the temperature? Yeah, water is required, hydration is required, but these 2 points also is the water points. You can use the SI2 and Sanjo 2 always is good. Rather than putting as a tonification, even you just sedate or you can apply perpendicular, doesn't matter. You just use these 2 points is always is good. If you have the temperature, it may be 100 or 101 degrees, something like that. So these are the 2 is quite enough. But still you wanted to know when the temperature comes, what happens? The person will stop eating. First he will stop eating, that indicating small intestine is affected. Later it is affected the stomach as well. When the stomach is affected, anorexia, that means loss of appetite. Whatever you give him, he says, please, I cannot take it, I don't want any food. That indicating his stomach also affecting now. It started in preliminary level, now it has gone to the secondary level of the temperature. That's now his stomach is affected, indicating Yang Ming meridian also affected. Then what need to be done? then you just use the point to activation to the stomach, that to be known as a Zhu San Li. Generally you can use as a stomach 36 as an activation point number 2. Then further you wanted to use something else as a stomach also, then here Yang Ming is affected, then the colon also affected, large colon. Then add up the another point, which is the best cooling point in our body to be known as a Chu Chi. That is Li11. Li11. It having the cooling effect in the body, because Yang Ming only that have the more energy and also more vital force in that. But definitely once the bowel movements it passed in the stool, then you remember, then when intestine is empty, small intestine is empty, your fever goes naturally. That's the reason. Add up the point as a, now I am talking about the clinical points. Use this is the Li11 bilaterally or the ipsilateral. That also quite enough. Number third point to be known as a, you wanted to add up as I told you is the Sanjio. Sanjio, you can use the proven that. You can use the Wei Kuan. Wei means is the stomach, Kuan means is the gate. So Wei means is the outer, Kuan means is the gate. That's called as a outer gate. You can use it. That's called as a triple warmer 5 point as well. If somebody are suffering, children are suffering or somebody else, but ask them to activate Sanjio 5 every 3 hours or every 2 hours, continuously they activate the point. But definitely paracetamol, how this will going to work in the body system. Likewise the Sanjio 5 also, this is because the point itself known as a nexary point, luvo connecting point, communicating point, passage point to the triple warmer to the pericardium. The pericardium is related to the hotness, the heart to be known as a heat condition. But now hotness excessiveness which leads to the temperature, then that to be regulated by using the Sanjio 5, that's communicating to the pericardium indirectly. Therefore the heat or hotness will come down naturally by activating that Sanjio 5 point. These are the common protocol, you can use it, but still severe infection is there. Maybe some virus infection or perhaps bacterial infection. Mostly the greater than 80-90% of the pyrexia condition, fever conditions are due to the viral infection. But viral infection may not be required any antibiotic, by the way. So when there is another complex infection is there, that time we do require as a cephalosporin derivatives or the quinolin derivatives, some kind of the medication required to suppress the growth of the bacteria or the growth of the virus in the severe conditions, but otherwise may not be required. But still as per the acupuncture, you wanted to use some of the points, you can use the Ta Chui. Ta Chui is the DU14 which is existing on the neck region. You just strongly activate that point. Even that also proven, you just strongly activate, the fever will come down within minutes as well. But the people says, ouch, I do have the pain. Children may not be allowed to apply that point, but still you apply and do the stimulation, temperature slowly will come down, because all the Fu viscera is connecting point, that to be known as a Ta Chui DU14 point, just below to the 7th cervical vertebra, DU14. Then still the upper limbs and upper extremities or the lower extremities, or the upper body or the lower body having the infection. Now I come to the another level of the temperature. Once there is the anorexia is over, then that time the people says that time I do have lot of thirst, I wanted to drink the water. To drink the water, what is required? Because the spleen also affected for them. When the thirst get excessiveness, remember spleen having the malfunction which leads to the problem connecting to the he do have the thirst but he cannot take it, then spleen also affected. On that particular time you just use the spleen points here, that to be known as a dadu, that to be known as a dadu, the second to be known as a thai pai. Spleen 2 And spleen 3 during the temperature, they says I do have the muscles pain, I do have the body pain, that indicating they do have the pain because of the spleen also affected. Activate the spleen 2 and the spleen 3. Sir, is it required all the points need to be activated at a time? May not be required. May not be required all the points. Remember, timely you can use it, few points, that itself is quite enough. But still, as a conclusion, I would like to say summary of these points. The day-to-day clinical practice, if we see and we wanted to apply, use LI11 and then Sanjo 5 and then Hoku LI4. These are the 3 points also quite enough to treat for the temperature normally. But the classical way I told you what are the points to be activated, you can use that points as well. Along with that, in the naturopathy system, what we can consider, the normally, as I told you, every day 3, 4, 5 tender coconuts are required. Consume this water. Either you can use the juice, Mosambi juice is advisable, or the something is the anything connected to the vitamin C get excessiveness, you can consume that juice also, really good. By the way, you wanted to use as a wet pack, especially wet pack, you can keep it in the abdominal region. So you just apply on the liver region and also intestinal region. Places the wet pack for a few minutes, at least for 15 minutes to maximum 30 minutes the wet pack is advisable, and then definitely that have the positive impact. By the way, there is no cold and congestion, they do have only temperature. You wanted to place it on the neck region where the Ren-ing point is there, Thian-2 points are there, stomach 9 and then Ren-22. This area also can be activated. So then further you wanted to use on the glabella region, you can place it here also as a cold pack is advisable. In this way we can manage. After you getting the relief, then take the lukewarm water shower. You take after 1 day, 2-3 days later, but definitely after that, that also it eradicate your fever. But during the high temperature, you take the shower head to toe, then that having the impact that gets the problem more. But apart from that, you taking the shower also one or other way is good to treat for the pyrexia as well.